Hello, thank you for joining us. Today we will be showcasing products which are compliant with the new Canadian Heart and Stroke and AHA guidelines. My name is Stacey Haywood. I am the Sales Director for Spectrum Nasco Healthcare in Canada. Angela Honig, Simulation Specialist and Registered Nurse, will be showcasing the products from her home in Pittsburgh. Today we will show solutions for both BLS and ACLS to bring your training levels up to be compliant with current guidelines. This session is being recorded and will be posted for later viewing. First, we will do an overview of the CPR Plus platform, which is available on Buddy or Prompt, which include a combined adult and child mannequin or infant mannequins. The feedback it provides is compliant with current guidelines. This means it tracks compression rates, depth, recoil, hand placements, and an option for ventilations. The instructor and student apps are available for free to download on iOS or Android. The instructor can capture up to 6 students in one session using the simple app. There are upgrade kits available to add to your current mannequins if you already have a fleet of Prompt or Buddy CPR trainers. Take it away, Angie.
Hello, thank you. You want to take yourself off presenter? There you go. Okay. So today we have the CPR, this is the Buddy line. Buddy is available in a child, adult, this covers both of them, or you have an option of having the Prompt, which also has a baby, a child, adult. So both of them are available in both ways. With each mannequin, they have the lung bags, which we have a hole already punched in them. So when you purchase them, it's easily to be able to get the adapter pieces and connect them as well, so that you can have the respirations recorded with it. What we do is when we power them up, you're going to flip the mannequin over and you're going to push the power button below the battery for this one in order to do your also pairing. And on the infant mannequin, and this, you're going to take the chest off and push the button here. What you want to make sure of is that this adapter piece is connected to the lung on both the adult child mannequin and this infant one. So I'm going to hook that up really quick and put it down. Okay, next I'm going to share my screen with you guys so that you can see what the apps look like. Oops. Okay, here we go. So let's get the screen up with that. First, we're going to start with the student. You'll see on the student here, you're able to go in, there's an option to connect here. I'm going to choose so you can see the mannequins that are available as they pop up. First, I want to go into settings for you. The settings allow you to choose your languages, which one you're utilizing. Also, it allows you for the score calculation, compression metronome, which will play so that it's audible for the students to hear. And here you can choose your guidelines. So if there's a change in guidelines further down the road, you just have to click the new one as it's updated without having any additional purchases. You also have cycles you can choose and everything else. Let's go back to pairing. I'm going to choose the infant this time to be able to show you how to do it. So with the infant mannequin, you select the mannequin you're choosing and you'll see as it connects. You have the option then to do conventional CPR or hands-only CPR. I'm going to do conventional. So you would start as a student and you can see if it's too fast, if you're too slow, if it's too weak. So it kind of records everything going along with this. And it keeps up top there in your cycle how many compressions you've done as they're going through. Stop and do a rescue breath. You can tell, obviously, it's too much volume going in the baby. I'm going to end here so we can go in and look at this. What you end up having is you get a feedback of the results, what the compression rate was, the depth, and what the percentage was and how they did, volume and how much hands-off time you had. You can also create this into what would be a PDF or something that the student can take for themselves or to be able to share with wherever they are as a student or as a full-time faculty. Next, I'm going to go into the instructor app. The instructor app for this, when we open it up, you'll see the same choices, your CPR. I'm going to go in now and choose the Buddy mannequin. So when I select the Buddy, since it's an adult or child, what you'll want to do is go into settings and choose what is your target audience. Oops. Target audience here. My target audience, I'm going to use this in note, but if it was a child today, I could be able to hook that up as well and choose that instead. So I'll go to training. Inside of your training, you have your data that's available that you can go and see who has done what, be able to go through there. You also, back to training. So conventional CPR or hands only. Once again, I'll do conventional and I'll hit start. So as I'm doing my compressions, you can once again tell if I'm too weak, if I'm too slow, if I'm too strong, or if I'm too fast. I'll stop here and do my respirations. Be able to do good volume, and then go back to compressions again. We'll stop and we'll share this information with you. Pause, and then we hit end slot, end this, and it's going to bring up the ability for you to be able to see the summary again. But what's nice is it's added a graph in so that your student can go and see what had happened, and you can review that with them. You have the option then to send this result, keep it for yourself for a PDF, be able to print it if you would like, for records, to provide with the person. It's also kind of neat is you can also go in and change the student and put their name in there so that they can have it recorded. If you go back into here, you'll be able to share a certificate. That certificate then has their name on it, the date they completed CPR, and what they utilized. Thank you and have a great day.
Fantastic. Thank you so much. That's great. Awesome. Thanks, Angie. So I'll let Angie just trade out some equipment here, and then we can start the ACLS portion, or the portion showing the HeartySense Premium Kit. So give us 1 second. Sorry about that. And I will start to do the intro while she gets her equipment set up. So welcome to the ACLS portion of our offering. This is the HeartySense Premium Kit, which can be used on any adult, child, or infant mannequin of any brand, low, mid, or high fidelity. So you can use it for ACLS or BLS. Torso or full body can be used. This is simply added to your current equipment and provides the feedback to allow your training to be compliant with the current guidelines. Today, we will be showing it with our child crisis mannequin. So Angie, I'll let you take that away if you're ready to go.
I'm ready to go. The HeartySense add-on kit comes in a box here. Inside of that box, you have what would be the communication device that plugs into your adapter for compressions, which there's an arrow showing you where the top is and then where the hand placement should be. There's also the ability to be able to hook this up to the bag, the lung bag, so you can get the respiration. Inside of the kit, you're provided a template and a hole punch so that you can put the hole in the right location to be able to put on those adapter piece. The adapter piece, must have dropped that. And then this adapter piece then goes on. When you're not utilizing it for CPR, you can just put a piece of tape over the top of it to close it off. Let me hook this up. So I'm going to open up my chest skin here. I'm going to attach the lung piece on there. For this demonstration, I'm just going to have the skin up on the pad up on the top of the mannequin, possibly not do adequate compressions. Next, I'm going to turn on the unit. You'll just hold it down until it lights up, waiting to be paired with something. Now I'm going to share the app with you. We'll start with the student again. Okay. And I'm going to go with the HeartySense student app first. In the student app, you're allowed to go in and select your compression rate, what age of the mannequin it is, everything that goes along with that, and you would confirm it, choosing your language as well inside of here. We'll stick with English today. What your CPR guidelines you're utilizing, be able to change those and everything. Now I'm just going to connect the kit. Inside of this kit here, you have the option of correcting just specific skills or your full CPR scenario, compressions, breaths, or both, adult or pediatric mannequin. And then you can choose your cycles. Is it a lay responder or a healthcare provider? I'll hit start.
You and your classmates are having some discussion in a lecture room. Suddenly, one of your classmates grabs his chest and falls down on the floor.
Oh, what's happening?
No one in the room knows what to do next. Now, what should you do?
Get help. You'll see that if hand placement is incorrect, I'm going to chart again. And it continues to kind of count as I'm going through it, how long I'm going in, what my rate looks like. All of that inside of there for the student. And then just, they can continue to practice as they'd like. Next, I'm going to go into the instructor app. Inside of the instructor app, I'll turn this, it's a little bit easier. It opens you up to be able to look at assessment. You can choose specific skills, full scenario, whatever you would like. Compressions in breaths. I'm going to choose compression in breaths. How many cycles is a healthcare provider and the age? Some other settings that are inside of here in general allows you to be able to do your language, what mannequin you're utilizing, what guidelines as well, again, the date format, and what your compressions are going to be. You can confirm that. You also have the ability inside of here to be able to go into that settings for assignments of students. We're going to choose, we'll end up choosing student number 2 in the end, or for B. And then we'll be able to apply or bring in an LMS as well. And you can put email addresses in and log into here as well. Here gives you what whole sped data for user 2 here. I can send this off to someone if I'd like to send the data. Gives me lots of choices. I'm going to connect my kit now. And it says start right now. I'm going to assign my student really quick. Let's give apply my student. So as I do my compressions here, I can show what's going on if they're wrong. Unfortunately, I have a little bit of a bum shoulder. Well, I would hit finish up here. And when I finish up, I can view the data. Inside of here, it's going to give me my compression ratio, all of those things along with it. And you can do that for up to 6 people as they're doing it. Currently, we only have 1. And then once you're ready to go again, you can hit restart and bring yourself there.
Awesome. Thank you so much. That was great. I really appreciate you sharing that today, Angela.
No problem.
And for contact information, if you need to reach us, you can reach me at Spectrum Nasco on our website, spectrum-nasco.ca /is healthcare. There, I'm sharing my screen right now. And my contact number is here, 905-717-0360 is my mobile number since we're working from home during COVID. And my email is shaywood@spectrumed.com. If you need our French office or our US office, I certainly will refer you. So feel free to use my contact information and I will refer you to the appropriate sales office. Thank you and have a wonderful day.
Thank you, everyone.